Across the Atlantic Ocean, over 4,000 miles away from College Park, Maryland, stands the northwestern African country of Sierra Leone. Sierra Leone is located between two coastal nations, Guinea and Liberia.
Sierra Leone is ranked 179th by the Human Development Report with an HDI of 0.420. The country's population is currently 7.3 million, but is growing at a rate of 2.38%. This high growth rate is attributed to the high fertility rate of 4.73 children per woman.
Unfortunately, the growth rate of this nation is significantly diminished by high infant and maternal mortality rates. Out of every 100,000 live births, 1,360 mothers will die, and for every 1,000 live births, 68.4 infants will not survive. Sierra Leone has the highest maternal mortality rate in the world and the 10th highest infant mortality rate.
Only about 50% of births take place in a health facility in rural Sierra Leone, and only 43% of births are attended to by a skilled physician. The main reasons a woman will die during childbirth are hemorrhage, infection, hypertensive disorders, and obstructed labor.
Our organization, Sierra Leone Women's Health Initiative, will be using our $1 billion budget to support the mission of our organization to alleviate the risks associated with giving birth by providing medical aid to women in rural Sierra Leone. Our vision is to significantly decrease the amount of maternal and infant deaths by increasing the amount of trained midwives in rural communities, as well as educating communities to become more medically literate.
The top 3 development priorities for our organization are to decrease the maternal mortality rate, to decrease the infant mortality rate, and to decrease the total fertility rate within rural Sierra Leone. In order to achieve these goals, we will partner with organizations including Doctors Without Borders, Marie Stopes, and Interval that are already making significant impacts on maternal and infant health in Sierra Leone.
Doctors Without Borders sends medical supplies in teams ranging from 4 to 12 doctors in areas in need. We will ensure that all teams are equipped with supplies specific to prenatal and postnatal care, as well as supplies necessary for safe birthing practices. 60% of the country's population lives in rural areas, and since these rural areas experience high infant and maternal mortality rates, efforts will be focused here.
In order for this change to be sustainable, these health professionals will also be providing medical training to community members and supplying communities with sufficient medical equipment. This program will help train local community members to be midwives, providing both increased health security and a source of education and employment for women in rural areas.
Due to the economic conditions in these rural areas, a risk we face may be a lack of participation due to poverty-related causes. We will mitigate this by incentivizing the training by providing financial compensation for the men and women who become trained midwives in their communities.
Interval is a non-profit organization that operates similarly to Doctors Without Borders. They specialize in transporting surplus and unused medical equipment from developed countries to developing countries. With the help of this organization, we will supply and distribute medical kits containing maternal and infant health supplies to train community midwives.
We believe that collaborating with Interval for their access to medical supplies and Doctors Without Borders for their expertise in distributing trained medical professionals will help us maximize our organization's impact by taking advantage of these pre-existing systems.
There are only an alarming 0.02 physicians per 1,000 people living in the country. By implementing our joint program, we will be increasing the number of medically literate people in the country and hopefully decreasing the death rate.
The average woman in Sierra Leone has sexual intercourse for the first time at age 16 and gives birth to her first child at 19. The contraceptive prevalence rate is only 16.6%.
Marie Stopes is an organization that is currently working to increase contraceptive use, so they would be a great implementation partner for our organization.
As of 2016, it is estimated that Marie Stopes has prevented over 100,000 unintended pregnancies and has influenced over 300,000 women to begin using contraceptives. Marie Stopes provides half of the contraceptives that are being used in Sierra Leone.
In spite of the work that Marie Stopes has accomplished, the overall percentage of contraceptive use in the nation has not changed significantly. We believe that since our organization focuses on the more remote rural areas of the country, we will be able to increase this percentage more significantly. A risk associated with encouraging contraceptive use is the fact that larger families may be more advantageous in rural areas that rely on agricultural farming. To mitigate this, education will also be provided about some of the advantage of having smaller families.
Our $1 billion budget will be allocated according to this pie chart, with $400 million for medical expenses, $300 million for education and training programs, $150 million for contraceptives, $80 million for traveling costs, and $70 million for food and housing costs for participants.
In order to monitor and evaluate the effectiveness of our intervention, we will conduct periodic surveys to determine the contraceptive usage among women and collect biannual data to determine the maternal mortality rate, infant mortality rate, and gross total fertility rate. This data will be collected in individual rural communities, and the data will be supplemented with published statistics from international organizations such as the United Nations and the World Health Organization.
The aim of Sierra Leone Women's Health Initiative is to see significant decreases in each of these factors within 15 years of the implementation of our intervention.
We one day hope to see Sierra Leone become a place where motherhood is safe and women have more autonomy in family planning.